as they combat this kind of a serious public health emergency.
Our next question is from Stephen Triedman of Eastside Monthly. We've heard from a number of small fitness, Pilates, spinning, and yoga studios that fall under the large gym umbrella and remain closed. They are desperate to reopen to survive and have asked if there could be a sub-classification in the gym category that would allow them to open sooner.
It's a great question, and literally something we've been working on today. The answer is yes. We're trying to figure it out. I don't have something to tell you now. As of phase 1, they're still closed. The official guidance is no change on Saturday. However, I understand what you're saying, and we're working very hard to try to figure out which subset, how to define it, under which safety guidance. And actually, we're in discussion with a number of folks who own those sorts of studios. So as I said 10 minutes ago, we're going to continue to have updated guidance. Maybe I'll have an announcement on that in a week or so, and we're trying to get there.
Bill Bartholomew has the next question. Governor, some restaurants in Providence have announced that they are not going to open during phase 1, citing risks to guests and staff. Are you counting on individual business owners to assess that risk, or would you prefer a more unified approach within industries and sectors that is driven by your decision?
You know, it's an excellent question. Look, at the end of the day, I can't force somebody to open. If they just don't feel safe, then I understand that, and they're gonna do what they think is right for them and their employees and their customers, and I absolutely respect that. Having said that, there's a lot of people out of work right now, and we're doing a huge amount of analysis, taking it slow, making sure it's safe, giving extra guidance. So what I would say to them is, and I'm going to say this to everybody, I know you're afraid. I understand that. But we do have, as long as we go slow, remember, our goal is don't let the virus get ahead of us, but if we go slow and follow the new rules, we got to get back out there. We have to be brave. Smart, follow the rules, but brave. And so that means getting back out there. So in phase 1, restaurants are closed anyway for in-room dining. But and again, I'll never force any in particular business to do what they think is not in their interest. But what I can say is, when the time comes to open for in-room dining, we're going to give you our best advice, and we think it's safe, and so you probably ought to do that.
Michael BiLo of Motif Magazine says small businesses approved for PPP have a June 30th expiration deadline without congressional action, but don't know to what extent they can reopen by then. What is your best estimate of what July might look like for bars and dine-in restaurants? Could they be at full capacity?
It's possible. You know, it's impossible for me to say the first week of May what the last week of July is going to look like. This thing changes daily and weekly. I think it's probably unlikely, but I don't know. Look, listen, our goal, it all depends on our experience. And that's why in the beginning we really want to take it slow. If the experience is such that when we're all going out and restaurants are at 50% capacity and we're not seeing an increase, then it'll give us confidence to relax. But it's just, I can't honestly give you an estimate now because, candidly, it depends what things look like in a month from now.
Continuing the theme, Ted Nisi of WPRI 12 says some business owners say they want to start reopening in phase 1, but claim their employees say they won't come back because they're making more money on unemployment. Is that allowed, and what should employers do in this situation?
It's an issue. I'm going to say that is a real issue. I want to be careful here because I am so deeply grateful to the United States Congress and our congressional delegation for moving quickly to expand unemployment insurance. It was the right thing to do, and it is saving Rhode Island. On the flip side, the additional $600 check, which was well intended, is, you know, that's a factor. It's relating to what you say. Now, it does expire. So definitely when that goes away, that calculation will change for people. Here's what I would say, and this is what I would say. Do the right thing. Like, it does it does frustrate me that, this was an initiative intended to help people get back on their feet. It was not an initiative for folks to make more staying home, and then that hurts their business. That was never the intent. In the long run, you're going to want your job to be there. So if your employer is reopening, I'd encourage you to work with your employer and get your job back. And, there's only so much that we can do. What we are trying to do is help businesses find employees. So we're using Skills for Rhode Island's Future. We're doing a lot of matching. We're trying to train employees and work with employers. But I can't deny that what you say is a fact, and it's what's happening in the labor market. By the way, not just in Rhode Island, it's happening in America.
Steve Allquest of Uprise RI has a question posed to both the governor and Dr. Alexander-Scott. What kind of guidance are you getting from the Commission on Health Advocacy and Equity, established to advise you on racial, ethnic, cultural, and socioeconomic health disparities on your reopening plans?
I very much appreciate that question, Steve. Our leaders in our RIDO Health Equity Institute are working very closely with the leaders of the Commission on Health Advocacy and Equity so that we can assess together ways to place a racial and equity lens onto every element of our reopening. When the governor walked through the triggers, for example, for moving into phase 1, it was that effort that helped lead to why one of them includes making sure we have the capacity needed in our communities disproportionately impacted by COVID-19. We also want to continue to work together on how we can incorporate that lens into our reopening. We've already begun thinking about how to make sure businesses within communities hardest hit are able to participate and engage with us in the reopening process. And we'll want the Commission for Health Advocacy and Equity to continue to hold us accountable, knowing how critical it is to make sure that on the other side of this, we have communities in every zip code in Rhode Island who has bounced forward to be stronger, more economically resilient at the end of this pandemic so that we can all be prepared going forward together.
Christian Winthrop from Newport Buzz asked you, Dr. Alexander-Scott, how many travelers entering Rhode Island on the mandatory 14-day quarantine have tested positive for COVID-19?
That's a great question. It's similar to the one that was asked yesterday about how many out-of-state visitors were hospitalized. That's data we are still culling. We haven't forgotten about that question. It requires us to go back through every single hospitalization and now case to help understand that. But my understanding, particularly for those who have traveled and needed to quarantine, that number is relatively low. The quarantining process is a critical one. It allows us to help make sure that someone can monitor at home, not in the public setting, for symptoms to develop, and then we can work towards getting them tested. So the number that we will have, which we'll work towards obtaining, would be among people who were unlikely to transmit the virus to another person because they were following the process appropriately, and that at all times is the key. We want to make sure that someone does not transmit COVID-19 to the next individual by doing the social distancing, wearing the masks, quarantining upon return from travel, and washing your hands regularly.
Governor Doug Lizette has another question about gyms. When will they be able to reopen, and what rules do you expect they'll need to follow?
So gyms, we're targeting for phase 2. It's a little bit more complicated, obviously, with equipment and sanitizing the equipment. As I said, in an ideal world, we think phase 2 will be about 14 days, from phase 1. And what rules will they follow? I don't now know. We're still working on that guidance, but it'll be, much as you would expect. More social distancing, limited capacity, perhaps limits on the number of people who could be in the gym at any one time, extreme cleaning protocols, et cetera.
John DePietro asks, can churches open Sunday for Mass on Mother's Day? Why not let churches conduct Mass outside or by using spacing in the pews? Why don't you consider church an essential business? And lastly, faith is not a social gathering.
Yeah, so it's a good question. Like I said, we've been talking an awful lot to all faith leaders. I've decided to go for now with the five people. So you could have 5 people in a church or synagogue and broadcast that. You can certainly do, lots of folks are doing the drive-through services, and something more will come soon. But everything I know says take it slow. It is so much better to go slow and gear up than to go too fast and pull back. So if that means waiting another couple of weeks, as hard as that is, I have decided, in consultation with many leaders in faith communities, that that's probably the right way to go.
As Dr. Alexander-Scott mentioned earlier, and this is Tim White's comment, 2 residents at the Veterans Home who have tested positive for COVID-19 have died. Staff members have told us there is a shortage of workers and PPE there. What is your understanding of resources at the home right now?
Yeah, it's definitely a place where we are focused in terms of making sure that the adequate PPE is there and that we're responding to the staffing needs. Sometimes it can happen quickly and the message can come through that someone isn't available to come in for their shift, but then work is done in collaboration and they're able to address that. So that's something that we're in constant communication with the Vets Home about, as well as the other nursing facilities, to help support them in coming up with the solutions for stable staffing. And I really credit our team that the governor referenced earlier in helping to make sure that we have personal protective equipment as a state. Our priority is the healthcare workers in hospitals as well as in our congregate care setting nursing homes. So they know, and we are very quick to respond whenever additional PPE is needed, that we get it to them. So that's been our focus.